Many women suffer from pelvic pain and the pain with intercourse due to vaginal dryness and tight pelvic floor muscles. The pelvic floor is a set of muscles that support the pelvic organs and allow for normal function. We spoke with Dr. Angel Marie Johnson about MonaLisa Touch, a quick, non-invasive office therapy for pelvic floor disorders of the vagina.
MonaLisa Touch is a laser technology that is FDA approved to treat skin conditions. However, in recent years, it's been used more and more off-label to treat vaginal conditions, such as dryness, urinary incontinence, and painful intercourse. These conditions typically result from menopause or side effects due to cancer therapies. As a urogynecologist, I work closely with each patient to understand their symptoms, their goals, and the risks and benefits of whatever treatment I recommend, which includes MonaLisa Touch. Many of my patients have experienced success following MonaLisa treatments, but it's not for everyone. Using a small probe equipped with a carbon dioxide laser, I gently deliver treatment to the vagina and pelvic areas. The laser stimulates the production of collagen, which in turn creates healthier tissue. In essence, the vaginal cells thicken, blood supply is improved, and the vagina cells plump up to produce more moisture. This can result in less discomfort and pain, especially during intercourse. MonaLisa is gentle and well tolerated, although it's important to understand that no procedure is without risk. That said, the procedure typically only takes around 5 to 10 minutes during an office visit. Patients can return to normal daily activities after the procedure, although we typically ask patients to refrain from having sex for 2 to 3 days. The patient receives 3 treatments 6 weeks apart.
Greater Boston Urology was founded in 2010 with a vision of bringing together many of the most sought-after urology physicians and specialists in the nation to provide extraordinary urology care with the highest level of patient service.